Okay, that looks good. All right, I'll call to order this meeting of the Assembly Health Policy Committee. It's November 3rd at 10 a.m. Carissa, would you like to call the roll, please?
Sure. Mr. Persverdia?
Here.
Ms. Solotel?
Here.
Ms. Allard?
Here.
Mr. Constant? Mr. Dunbar?
Here.
Ms. LaFrance? Ms. Gwen-Davidson? And Mr. Rivera?
Present.
Thank you.
All right, welcome everyone. As usual, if you'd like to get into the queue, please put something in chat so I can see it. And our agenda is primarily focused today on updates from the health department. We're going to do an update from them and then talk about the alcohol tax 2022 and then any COVID-19 updates. So just before I begin, I'll check with Meg. Is there anything else that we need to add to the agenda?
No, thank you.
Okay, well, wonderful. And just for the record, I'd like to note that John Weddleton is now here. And then I'll hand it over to Mr. Gervais to begin his updates from the health department.
And I'll note that I have some assistance from Dr. Savitt around the report to the Health Policy Committee. So I would first like to thank the Assembly for the rapid action on all the items to support sheltering, which, you know, is in essence supporting the health of our clients in these shelters. So I want to say thank you for the rapid action on that and the assist with getting it pushed through and amended and properly met. Big lift for us. We really appreciate, particularly the family emergency sheltering money is going to make a huge difference to people that are suffering, you know, the effects of the COVID-19 pandemic to these folks that are really, really at high risk, particularly helping kids. So thank you for that. Dr. Savitt, he might have been a minute behind me. Dr. Savitt, have you made your way in, sir? All right, I will keep going then if you don't mind, sir. Is that okay with you? First, I guess I would ask if there was any questions around the last health policy report that we submitted. As you know, we've gone through some transition. We have a new PIO. The PIO generally takes that report, posts it, and sends it forward. And I know it looked a little different because we've been having some hard time getting data from the state of Alaska around some of this, as you saw. On a positive note, the reproduction rate from the state is at a 0.92, which is a positive. Anytime below a 1, we all know that's a great metric when we see that drop below a 1. So 0.92 is a very promising reproductive rate. And of course, we'd like to see it just keep falling. So I always like to start with the good. Lots of opportunities to continue all the other preventative measures that wrap around COVID-19 and prevention of transmission. So, you know, we can talk about masks, but I think we're also doing a great job with social distancing. I saw the capacity limitations, not just at your facility in the chamber and the theater, but all over the city. I'm seeing some pretty encouraging signs when I'm in places. I'm out and about quite a lot. And, you know, that had an impact on our shelter. I've seen a lot more people in masks when I've been in there the last few days because it's kind of just the mentality across the city. So, again, you know, you led the way and it has had a positive impact. First couple of weeks in the shelter that I was there for the health department, I saw maybe 10% mask usage, and I'm seeing quite a lot, extensive mask usage inside the shelters, which is a, you know, we're not just worried about, as everyone's aware, COVID-19 is just one of many, many concerns in any kind of congregate setting, whether it be our shelter, corrections, and we've been managing that situation at the Sullivan and other non-congregate sites. Let me run down the hall and see if Dr. Savitt's having pending any questions about what I've said so far.
No, I think we can wait for you to get him.
I do apologize. He has IT issues.
I'm here.
Oh, there you are, sir. Did you want to kind of talk about the health policy report from Agnew Beck, sir?
Sure. The most recent one is pretty much what we've heard in the past in terms of the format. The important pieces of information on here is we're continuing to see a downward trend. 14-day rolling average is at 88 per 100,000. 7-day positivity is at 9%, where it has been for the last week or two. New cases are down as of yesterday, 174. Vaccinations, these are corrected, minus J-Bear. We have a first dose of 69.6%, a completed dose of 64.1%. We don't have booster numbers yet or third dose numbers. As Joe mentioned, our reproduction is 0.92. That's below 1, so we know above 1 is epidemic or pandemic, 1 is endemic, and below 1 means cases are declining. We can see that in our number per 100,000. Continuing with that, we know that some of this is repetitious about the Delta variant being the dominant variant. Tests are continuing to be about the same number as before. I think that's really the highlights of the report, which you've all had a chance to look at. What's new is the FDA, CDC, and ACIP have all approved pediatric vaccinations for the 5 to 11-year age group. We're doing a rollout on that in conjunction with our state partners, with the state chapter of the AAP, as well as we're setting up for pediatric vaccinations at the vaccination site in the Diamond Mall. I went through there Monday afternoon. We are setting up.
I'm sorry to interrupt you. I have a few. Can you possibly, you or Joe can share the report that you're reading from in the chat?
I'll handle it, Doc. I'll handle it and send it out.
Thanks. Sorry to interrupt you. And just for the record, I want to say that member LaFrance is here as well. Go ahead, Doctor.
Okay, so the Diamond site has currently been set up for adults. We are now reconfiguring part of it that will be away from the adults to be able to do the 5 to 11-year age group. We have the ability to have 2 separate rooms which can be closed, have doors so that can be closed for privacy, because the kids will have to get undressed to some extent for the vaccination. There are 2 rooms for that, and there's a small but common waiting area in between, where they can sit to wait to be vaccinated. The plan is to do this by appointment. That allows for all the necessary paperwork to be done through the PrepMed, including consent, informed consent, and explanation or education on the vaccinations will be done to the families while they're there. I think that's really the most important thing. So I'll turn that back to you, Joe.
Thanks, Doc. I'm sending that email now, and I included the last 2 weeks just in case during the changeover of the PIO you didn't get either report to the assembly members. And I should have probably just sent it out preemptively again. We do post it to our website. As the doc noted, encouraging numbers. No one's saying we're out of the woods, not at all, never would. Just encouraging numbers. It looks like we're making some forward motion on some actions that have resulted in a decline of transmission rate. The transmission rate being the most promising number in that report currently, and that's from the state of Alaska, Dr. McLaughlin, not in-house number. Let me hit send on this just to make sure you had it. It went. I'm looking at a screen. I just need to switch over. If you'll bear with me for 5 seconds, and I'll be right back to you folks.
Sure, and I just wanted to make a note to Carissa. Let's try to coordinate in the future so that we get that report posted up onto our our site for the committee prior to this meeting, and so that'll be an important, I think, thing for the future. In the meantime, I don't see any questions in the queue. I did have a question for Dr. Savitt. You were talking about the testing for Diamond Center. Can you talk about the coordination with the Anchorage School District in terms of vaccinations? Are you coordinating with them in terms of their work to begin to offer those?
I really don't have any information about the school district. They're a separate entity, as you know. Perhaps Joe has more information about that.
Okay.
Yes, sir. And I would love to follow up on that. I do want to keep this committee highly, with the most current information. I would like to talk about, starting with ASD, we've reached out. The ASD feels very confident in their ability to vaccinate the children that they provide services to, and have instituted a plan. We're aware of it. We are not a partner to it, as they, like the doctor said, they wanted to kind of handle it in-house. And they did such a great job last, January, February, just their medical team did an outstanding job vaccinating the entire community, not just, people inside the school district staff. So they have instituted a program that's very aggressive in-house. We're aware of it, but they did not need any support from the AHD or the state of Alaska. The state of Alaska is supporting them a little bit, but they really have, they have told us that they have the ability to handle this mission in-house with some minor support. With that, the AHD has reached out to community partners, particularly places like Ptarmigan Pediatrics, the big pediatrics, Latouche Pediatrics, and we're supporting them in any way. As what I mean by that is our clinics can provide vaccines. So if they run short so that no child isn't vaccinated that might be at one of these places that ran short, we've arranged with Visit Healthcare to provide from their pharmacy immediate resupply if they were to run low. And so one of the nice parts of this, we're serving in a support mechanism, not just if the ASD needs it, we're ready to respond, but we're also supporting the community vaccination sites. Coupled with that, we've actually had some growth, for instance, not related to vaccinations per se, but we have actually, we're adding another community testing site over in the Spenard area because we hear they're going to pull the state's testing site behind security, so there won't be access. So to react to that, related to the update overall, we are setting up in a partnership, another free clinic over near the airport so people can access a resource, but it won't be like what we currently do where we fund the bill. It's going to be free, and we've arranged for a vendor that will be able to bill the federal government directly through HRSA, or bill insurance, which is really the intended reimbursement rate. The feds really just wanted to reimburse for people that didn't have insurance. They never really felt it was their duty to carry everybody. If you didn't have a resource, they wanted to provide that. So we're working with that kind of operating theory to add some bandwidth for testing. So we're not just accepting what we have. And the same thing with vaccinations. We're looking at a lot of the sites that we're doing testing in the community to also see if they can vaccinate like Walgreens does. You can get tested there for free. You can get vaccinated there for free. So we are looking at trying to find partners, community partners, and I've mentioned this before, that can support, the MOA with no added cost to the city, so we don't have to worry about a deficit in reimbursement.
Thank you, Mr. Drace. Yeah, that was a good answer. I'd like to I have a question in the queue for Mr. Constant. Go ahead, Mr. Constant.
Thank you, Mr. Drace. So you mentioned, pointing our attention to the case rates going down and some other information, but I would like to have also read into the record the hospitalization and death rates for the last week, so we make sure we're having an eyes wide open appraisal of the circumstances. I'm sorry I didn't have a chance to read this report before, so.
No problem. Dr. Savitt, do you want to handle that? You're the one in contact with the state epidemiologist, sir.
Okay, so I'll just read from the report. That'll probably be the easiest. According to the report, there were 334 total Anchorage deaths, 328 amongst residents, 6 non-residents. And this is cumulative from the beginning of the pandemic. So this is kind of misleading because you have to think of the original strain of COVID as almost as a different disease entity from the Delta variant, which we know started last spring, sometime around beginning of May. We're going to hopefully this week be able to readjust our numbers to reflect the differences. So that was an increase of 13 resident deaths last week. The count as of today is 337. I should say as of yesterday. We're always lagging behind by 1 day. If you would like to know the hospital numbers, I can give those to you. Those are also as of the 2nd, which was yesterday. ANMC had 21 confirmed COVID cases, 1 suspected. Their ICU had 7 COVID patients out of 15 total patients with a total of 20 beds. So they had available beds. 7 patients were on vents. There was 1 pediatric case and 0 deaths reported yesterday. Alaska Regional, 36 confirmed COVID cases. Their ICU had 7 COVID cases out of 18 total cases in their ICU setting for out of 18 available beds. They had 4 vented patients, 0 pediatrics, 0 deaths reported. Providence was reported on 11/1, so 2 days ago. They had 26 confirmed, 2 suspected COVID cases. Their ICU had 5 COVID patients out of 31 patients total, with 32 total beds. So they had 1 available bed as of yesterday. 4 patients were vented, 0 pediatrics, 1 death. That's the 3 Anchorage hospitals that we follow. Total ER visits for the 3 hospitals was 7.73%, or 31 patients out of were COVID patients out of 401 visits. I think the rest of the numbers we already mentioned. Total cases, which includes the beginning of the pandemic from 2019. 56,489 positive test results or cases. I think that would answer the question. The only thing I haven't included yet was the school district numbers as of today. This morning, they had 376 active cases for a total case count since August 12th of 4,163 cases.
So, and I would like to just briefly read from the report we've received, the summary from 10/29/21. It states, current hospitalizations on October 26, 108 hospitalized. The number of hospitalized cases ranged between 105 to 113, which is the highest range in a month. This is an increase compared to last week, where the range was 93 to 107. And if you look at the previous report on 10/22, it also states that as of October 18, there were 103 hospitalized. The numbers of hospitalized cases range between 93 and 107. This is an increase from 84 to 94 cases. So in 2 weeks, we went from 84 to 94 cases up to 93 to 107 cases. And then when you roll over to the death report that we have, it states that there have been 334 Anchorage deaths, 328 among Anchorage residents and 6 among non-residents. This is an increase of 13 residents since last week. And if you go then to the previous report, it reads, there have been 321 Anchorage deaths, 315 Anchorage residents and 6 among non-residents. This is an increase of 23 residents in the last week, which means 36 deaths in 2 weeks of this pandemic response, which is 10% of the total deaths.
So if I can answer what I think is a question there as to why are those numbers higher as compared to the downward trend. One, we know the state metrics are broken. Everybody at the state has, a lot of people, I should say, not everybody, has said so. The reporting is way off. The reported death counts that you are talking about are since probably the last 4 or 5 months being included. Those are not necessarily recent numbers. They're added in as they're reported to the state. And again, the state's reporting has been problematic at best. Why are numbers at the hospital still relatively high? is because even though the total numbers are looking at a downward trend, we know that hospital figures, hospital numbers, hospital cases always lag behind by 2 to 4 weeks. So you will eventually see those hospital numbers come down further, but right now they are still behind, or essentially reflecting the numbers that we saw 2 to 4 weeks ago in the general population.
Yeah, and I didn't really have a question there. I understand the difficulty of having the accurate death numbers because of the way that they aggregate deaths and count them over time. But while there was a presentation made to us, look, the numbers are going down, there are some numbers that are not going down in the report that we received. I just want to make sure that members of this body recognize that it's not a simple, nice story. There are complications to that simple, nice story.
Thank you.
Well, and that's why I mentioned what those numbers actually reflect, just for clarification purposes. But I appreciate your comments.
I think we have clarity. Thank you, Mr. Constant. Mr. Constant, do you have any other questions at this point?
No, thank you. I have to chew on these reports a bit.
All right, thanks. I have a couple more people in the queue, Mr. Weddleton and then Ms. Zolotel.
Thanks. I want to back up a little bit to what Joe Dre said about with the testing and perhaps vaccine as well, is that the first thing is to charge if people have insurance, and then we bill to that and then to the federal government. And that's something I kind of wondered about, but hadn't heard anything so clear on. So the city is self-insured. So when municipal employees go to get tested or vaxxed, is that something that we're paying for? And I don't know if you know how is that impacting our budget?
Well, we're sort of self-insured, but it's through Vera Healthcare, sir. We have been vaccinating, just to be clear. The health department has been providing vaccinations of city employees at no cost through many clinics. So particularly the front-facing fire, police, but the vaccinations are free at the Vera Health for the city employees, sir, to answer that question.
But we pay for Vera Health. I mean, is there,
yes, sir.
So is there no, so who pays for those shots then? I mean, we have to reimburse Vera to some extent, right?
I believe it's just in the basic cost, just like we don't have to pay them any extra if employees use the healthcare, sir. Preventative medicine under the Obamacare, a lot of things like, baseline mammograms, it's all covered as preventative medicine. The list is pretty long. And so this goes back to a larger conversation, sir, about healthcare in general, and the enactment of Obamacare put a lot of things in the preventative health group, which requires zero deductible and zero cost to the employee, which was further expanded when the original CARES Act came out, providing free care. They waived all the deductibles as part of that under people's healthcare. So even if you hadn't met your deductible, a lot of stuff was covered in that. So it's a much longer conversation, but I would say I don't expect the city to see any billing from Vera over this, because it is a preventative health. Just like if you needed a shingles vaccine, hepatitis vaccine, we provide those things at no cost to city employees, and we generally don't see a charge for. We're required to provide Hep B, for instance, to all of our forward-facing field folks. It's part of a requirement to protect our employees. So I could do a bigger presentation on that if it concerned you, sir, or this group.
No, I guess that's okay. I just want to, I hadn't heard anything that we were getting hit really hard. I mean, some years we've gotten hit really hard on our insurance because we had 1 or 2 employees with severe cancer or something, and even that's noticeable. So anyway, thanks.
Thanks, Mr. Weddleton. Before I go to Ms. Zolotel, just want to announce to those from the public that are on the call, we now have posted the 2 reports on the committee website, the municipal website, so you can access them there. Apologies for not having those in advance, and in the future we'll have those up prior to the meeting. Ms. Zolotel.
Thank you, Mr. Chair. So a couple comments and then a question. I would really like that we refer to the Affordable Care Act as the Affordable Care Act. I think that's the appropriate thing to do. And although I know the colloquial term otherwise, I haven't had the experience in using the municipalities testing to ever be asked for my insurance. So a little bit more if we're doing that now and when that change came to be. And then I'd love an update on our efforts to hire an epidemiologist. And I'm just going to give you like one last thing, and that is also, are we doing any outreach, or have we been reached out to by the hospitals for any assistance as they continue to move through this time of still high hospitalizations, or are we talking with them about what the landscape may look like when the additional staff leaves? Thank you.
Great questions. I think I got them all written down. Thank you for the Affordable Care Act. I use the euphemism because I think people recognize it better, but I do apologize, which is true, the right name for it. And it's been, modified several times to expand care over the years. So thank you. First, our epidemiologists, that is a great question because it actually relates to the report. And I think there's two pieces. So the epidemiologist interviews are, they have commenced. We are actually interviewing somebody tomorrow at 9 a.m. who is an MD, PhD with extensive experience in epidemiology over 12 years, currently works at Emory. We've had some candidates that had not a lot of epidemiology experience. One person had an MPH, another person was a external to a United States medical doctor that wanted to come here. But this person is a licensed physician with an MD, PhD, so I'm very excited. Great note. I would like to note Agnew-Beck's report that I shared. We run out of funding for this report come 12/31. The annual expense was $340,000 for this report. And I think that just being in full disclosure, as money has gotten tight and I have to come to you for emergency appropriations, in an effort to avoid that, I would like to stimulate a conversation that if we'd like to continue the external report through Agnew-Beck, or see if the epidemiologist comes on board and we can do some in-house, I would like to announce that as part of this. We will need to do a reappropriation to continue that report beyond 12/31. The last piece, we are interacting with the hospitals. We interact with the hospitals very regularly. There's hospital huddles. We interact with the many groups, and they have not asked for any additional support. We haven't had, I'll be honest, we haven't had a lot of feedback. They highly value the flex staff that came in as part of the state's injection of people to support the mission, but we haven't heard anyone say our business is going to fall apart or we're not going to be able to serve clients if we don't continue these people. I do believe a lot of the hospitals have attempted to make offers to some of these people, from what I've heard on some of the meetings, that when they see somebody doing just an outstanding job, there have been conversations kind of about, hey, would you like to stay on in Alaska, contractor, or come to work at XYZ facility? And related to that, we are having conversations around what it looked like with them having vaccine mandates and the exodus that was alleged of healthcare workers based on the vaccine requirement at several of these facilities. And it does not look like that occurred either, just to be full disclosure with this committee. And I think I got your questions, ma'am.
Yes, Mr. Chair, may I do a quick follow-up?
Yes, go ahead.
Thanks. I appreciate that. And I appreciate you flagging the Agnew-Beck cost and that report. I think that report is really important. So I would invite you to reach out to myself and Mr. Perez-Verdia. I believe there are probably some unallocated dollars in the health department budget from 2021 due to us having expenses otherwise covered by other funding sources. So maybe we can work together to find that opportunity and do it before the last minute. Thank you.
Yes, ma'am. That was why I mentioned it here. I found out about a couple of days ago in budget review with finance and Mr. Fisk, and I wanted to get that out there because I do know that a lot of people besides the health department rely on that report. So I will do that. Yes, ma'am.
Great. Mr. Joyce, you think that completes the item A, the AHD update? Are there any other items you'd like to put into that?
I should, in full disclosure, just one follow-up piece. Northway Mall, we do not have a lease. They've allowed us to continue through 10/10. The vendor being Visit Healthcare has expressed concerns, about 5 different concerns. One was vaccinating kids in a car it's unsafe. and they would not do it. So they identified also that it's getting very cold. It's hard to keep the vaccine safe, which we experienced at Dempsey Anderson last year in March. Being it's only 0.3 cc's, it's less than it's just a couple tiers of volume. It freezes very quickly, and you can't really keep it warm with a heating pad because then you violate the 77 degree that could inactivate it. So basically, because we no longer have a lease agreement for the land where the tent is set up, we'll be moving all of our operations, expanding operations at Diamond to safely vaccinate the children that we're referring to become eligible. In addition to that, that'll be an inside space where it's safe to vaccinate kids. They won't have slip and fall injuries, lighting injuries, snow plowing issues around being at the Northway Mall as we roll into the extreme dark and cold. Just wanted to be full disclosure on that.
Thank you, Mr. Joyce. All right, with that, let's if we can move on to the next item.
Cameron, I have to jump in there. There is a bit of a problem that I have to speak about. If we are moving all vaccination to the Diamond Center, we are suddenly leaving out every poor kid, every kid in a neighborhood that doesn't have families with 2 cars and 2 parents and the ability to get to the Diamond Center. And our north part of town and northeast as well are the area where we need to take these vaccines to for them to be receiving them and their lives to be saved. Because if you look even at the reports that were just submitted to us, you find that the demographic of people who are getting sick and being hospitalized and catching COVID and dying are Alaska Native people, African American people, Polynesian people, and they primarily or for the most part live in District 1 or East Anchorage. And so I'm not sure what the proposed plan is to mitigate the fact that we're just because of convenience or some fears or loss of the lease are going to concentrate putting opportunities for vaccination only in a part of town where people are pretty mobile. I think we need to come up with a plan B for the north.
I can answer that, sir. I do apologize. I guess I should have further spoke. We have vaccination at Tacotinu Commons, and we are continuing to operate that clinic. I was just referring to the one clinic that was at the Northway Mall. So we do have opportunities. We're continuing outreach in that through our mobile teams. We actually have increased our mobile teams deployments because we noticed that that clinic has historically been doing very few people a day. So we realized that despite having a clinic there, our outreach in that community was subpar. So we're accessing that through our mobile concept, which provides a little better support. So I do understand what you're saying. We have a 7-day-a-week vaccination clinic at Tacotinu Commons that we are also in partnership with. So I could get into the details of the mobile teams if it would help, but aware, and particularly as we see this location cycling out at the Northway Mall, we are shifting gears in our outreach program, and we've actually added staff to accommodate more outreach because we've identified that fixed locations are great, but we have to get out into the community events, into places where the people are, and at events where they are to support them.
So, Joe, if I might, I would like to see the framework for how that's going to be implemented, in particular for folks who live in Mountain View and who live in the area around Costco there. And right, so anywhere kind of in that whole section to the west of Russian Jack Springs Park, or even just directly to the east of it as well, because there really isn't a methodology for people who live in those areas to commute themselves to Tacotinu, which is still 5 miles away. So I certainly need to understand how we're going to approach that. So I look forward to understanding better.
Yes, sir. And I think I've said this at a lot of places, and I've said it since I was at Visit. I really believe some kind of mobile clinic being, what I wanted was a city bus where they could come in the front door, sit down, get vaccinated, wait their 15 minutes in those hard plastic chairs that are easy to sanitize, and move people out the rear door in a one-way pattern, for instance. We're looking at that still, trying to encourage the vendor to provide that. If they're not going to provide it, the health department has COVID-19 nurses and response teams. So we have 3 teams. We have the Visit Healthcare team, we have the EID team, and then we have the public health nursing team. If Visit can't meet it through their operations, we will meet the needs of the community through our public health nursing team or our emerging infectious disease EID vaccination team, sir. But I will be glad to sit down with you and share that. I concur. We've asked a lot of the community partners up there in Fairview and Mountain View to become participants where we support them with free vaccines or let us use their clinic. So I would encourage anyone that has any points of contact or leverage to help us. We want to be in those communities all over the city. It's not just there. We talked about being out on the curve at Tudor, a lot of places where we could just get more smaller community, kind of like our sheltering plan, not just a big Costco-sized location at the Diamond Mall, but some community clinics. We're at the Boys and Girls Club regularly on Muldoon and those kind of things. So we are looking at all those opportunities.
And in Mountain View, the Boys and Girls Club is a primary location for community activities. So definitely looking forward to seeing the plan.
Thank you, Mr. Constant. Thank you, Mr. Gerace. I have a question in the queue, Mr. Dunbar.
Oh, I actually pulled myself out of the queue, but it's okay. I guess I'll follow up on that. Okay. Another East Anchorage location, which I actually assume that they are using it, but just in case, Joe, the school district's primary office building at Northern Lights and Boniface there's a lot more people that live right in that neighborhood than I think people realize. There's a huge trailer park right beside it. And I guess we talked earlier about efforts to coordinate with the school district, but I'm wondering if that might be an appropriate location if we're not already using it.
I would answer that we have attempted to get the school district to let us use some of their facilities, particularly when they were talking about doing 4 schools a day, asking if we could reinforce that. I do want to say that every day we do hundreds of mobile vaccinations. And I think one of the pieces that maybe were worth noting, we are still supporting heavily the people that are isolated, ALFs, all these places that like the Boys and Girls Club. So that team is probably one of our most valuable teams because they get into those high risk, one-off kind of situations. So the school district has not, and we've reached out to the school board and members of the school team, school, not just management administration team, but down to the health department inside the school district. And they just really feel that that they have it under control. So if anyone would like to kind of maybe a facilitated process, the school district hasn't been real forthcoming with letting us use properties. Even on weekends, we had asked about maybe being able to set up, but they don't like the optic of AHD on school property. They haven't said no. They just haven't been like, sure, we're not using the school on a weekend. Go ahead and set up at XYZ school. It wasn't well received. I will just note that, sir.
No, I appreciate that. I guess I would just flag that I understand their security concerns around schools, but their primary administrative office building right in the heart of East Anchorage, I think is a little bit different. And so that might be, they might have a differing level of concern with that versus the schools. But anyway, thank you, Joe.
Thank you, sir.
Great. So, Joe, do you want to move on to the second item on our agenda? Oh, wait, actually, before you do that, I've got Ms. Allard in the queue.
Thank you, Chair. I just wanted to, excuse me, sorry about that. I just wanted to state a couple of facts. If we refer to page 4, I kind of slid across that and I should have commented sooner. I apologize, Chair. But I wanted to bring up the numbers that we've had 41% whites who have died from COVID, 4% African American, and 20% Native, and 0 to 19-year-olds. There have been no deaths in Alaska. So I wanted to make sure that when we say that the most impacted is African Americans and Hispanics nationally from COVID, it doesn't necessarily mean by deaths only. It means economically too. So I just wanted to put those facts out there so that there is no misinformation on the record. Thank you.
Thank you, Ms. Allard. Mr. Drace, would you like to move on to item number 2?
Whatever suits the chair, sir.
Yep, go for it.
I could talk about this. I'm fairly dialed in at this point. I think some questions came up during the budget public hearings, and I'd be glad to address them the best I can. I would say that we probably need to partner with OMB and maybe even the municipal manager's office for some detailed answers. But the alcohol tax update from the AHD, you know, promising numbers. I mean, I do like the fact that we are trending to look like better than forecast, which is always a positive versus the negative of not meeting the budgeted plan. So I'm very optimistic that we're currently looking better than we thought we would be. The alcohol tax is going to be integral to our housing and homeless response, as everyone on this call is well aware. It's a new, you know, brave new world. I think I've talked about another division inside 16 jobs that are currently in some way, shape, or form. You can pick between 13 and 16, depending on how you look at it, in the health department, are now going to be supported by the alcohol tax. That's a significant change in operations here at the health department. So I don't know what you'd like me to do here. I know we have also an alcohol tax full update coming. I think there was a lot of questions from before. So would you support me maybe just fielding some questions?
Yeah, that sounds good. And I have a couple of people in the queue, Mr. Constant and then Ms. Zalato.
Yeah, I'm not going to go backwards. I just want to assert that the information that was presented by the previous speaker was not fact. It was certainly uneducated opinion. And the demographics that we face in this town are not one-to-one when you look at the statistics of who's being impacted by COVID. And it would require, and Joe, I would appreciate a briefing at some future meeting that breaks down who is getting infected and the overall population statistics that we see, so that the facts can in fact be put into the record and not just my opinion or someone else's opinion. Thank you.
Yes, sir. I'd be glad to. You know, one of the things I think I've identified before, I'm really excited to have our epidemiologists come on board, because we can grab these Agnew-Beck and state reports and then even get you more information. If you tell me about a sustained concern, I could then continually monitor that position. Like you're asking, we've asked the hospitals, for instance, for more data. We just need somebody that's in the compile it and analyze it business. So if there are questions, reoccurring questions, the health department would be glad to note those and present them as part of our report, supplemental to Agnew-Beck or separate to this committee and to the whole assembly, sir.
Thank you, Mr. Drace. I've got a couple more people in the queue. Ms. Zalatel.
Thank you. So I would like to, and I'm going to just provide the context, and then if it's more appropriate that we move this into the alcohol tax work session, but I want to kind of provide some heads up. I believe some of the positions for AHD in the alcohol tax don't meet the buckets or the defined dedications. So really, I would love to see an analysis of those positions and how they tie to the dedications of the alcohol tax as we move forward through the budgeting process. I definitely want to see these positions retained. I just want to make sure we're using the appropriate funding source. Similarly, we typically talk about housing and homelessness at the Housing and Homelessness Committee, but since we're talking about alcohol tax and it relates to the health department, I'd really like to know what we have for unencumbered alcohol tax funds from 2021 and the intent of what those will do actually across the board as it relates to AHD. So anything that's unencumbered or unallocated moving into 2022 and what the recommended course of action for those unallocated funds will be. Again, you don't have to answer those questions now, but I think I mainly wanted to provide you a heads up as we either move into the alcohol tax update or work session separately, so that you could have the chance to do those two things.
Yes, ma'am. Noted. I will be fully briefed. I don't want to speak halfway here. I've made this mistake before. I do understand exactly your concern. I have the same concerns to make sure that, the optic is clear on any position, clearly meets the requirements. I see this regularly where we throw a title in something and just to help, maybe pull in a grant or a fund for that. So I fully agree with what you're saying, and I'll have that answer for you, ma'am. And the unencumbered / unallocated alcohol tax from the current fiscal year, I will get that answer for you too. I have pretty good optic, but I'll get you a full report on that.
Thank you. And then the final follow-up, and it's not necessarily with regard to the alcohol tax budgeting process, but the alcohol tax required us to report out, the metrics on how that funding impacted the community. And so maybe we can start to work toward a plan about how you'd like to report that out with regard to what HD administered as we move into 2022, so we don't lose the opportunity to hopefully celebrate some successes from 2021. Thank you.
And I would just like to note that this is, this is going to be a more complex, and it's not anything on the health department. Several of the partners that were grantees were having difficulty because of the COVID struggles just in their operations, getting some of those reports. So just realize that it could be a dynamic, kind of like the changing numbers from the state as they realize, analysis and a death from back in April gets added. We do want to say that we have a lot of this data, but several of our partners, particularly the smaller grantees, haven't they're just not Johnny on the spot with some of those reports. So just realize we could have to issue updated or revised reports. Thank you. But I will note that too. I've noted it.
Thank you.
Thank you. And I do have one more person in the queue, but before I go to Ms. Allard, I just want to reinforce the point from Ms. Zolotel that I do believe that report providing an update, you had said in your beginning that you feel like that things are going very well as it relates to the alcohol tax. I think it's really important that we're able to capture the progress of the work that is funded through that funding source and to be able to be really transparent about what it's doing and how it's working. So I think it's really important that we start to think about how to report that out. So thanks. I'll go to Miss Allard in the queue.
Thank you, Chair. I just wanted to state from the member from downtown had said personal opinion, and I apologize. I forgot to leave off that Dr. Savitt had given me those percentages and those numbers, and then if anybody has any further questions, they should refer it to the medical professional, Dr. Savitt, of the facts that he provided to me. Thank you.
Thank you, Ms. Allard. All right, so and it sounds like the remainder of our discussion around the alcohol tax can be held into the work session that we have coming soon. All right, so Mr. Gerace, did you feel like that you covered the COVID-19 updates fully in your AHD update? Was there anything else you or Dr. Savitt wanted to add in terms of our item number C?
I do feel like we've covered it. We talked about, change and, oh, I did hear a question. I would like to address a question. I apologize. I did miss an answer. We are not charging insurance or even asking for insurance at city-run testing locations, vaccination locations. It's an optional field that people can complete, but we don't have any opinion. If you don't have health care, you don't have insurance, welcome for a free shot, free test. That is the city's policy, and non-discriminatory, just welcome to the party, please get your test done. So I do want to note that I heard that come up. Third-party vendors, there's actually a third caveat, which is they have to fairly compensate the landowner, which is something we don't do. We borrow land from like Change Point Church and run it. But if we were to switch out the vendor, which we're not at Change Point Church, they would have to reimburse the church for the fair market value. That's the third caveat. Ask for insurance, bill HRSA, and compensate the landowner for the fair market value of space used for testing and vaccination locations. Just a full disclosure moment.
Great. Thanks, Mr. Gerace. I have one more person in the queue, and then I'm probably going to move to audience per participation. Ms. Zolotel.
Thank you, Mr. Chair. I just wanted to know, are we solid on funding for testing and vaccination deployment through the end of the year, or should we expect to see another request for funds to keep that work moving through the end of 2021?
We are not solid. We are solid through the end of November and working as we speak right now. Now, the burn rate is not as significant as it was. So the money that we appropriated will maybe stretch beyond 30 November, but we will to get through the end of the year or into next year in case we want to get around the holidays and some of the other actions at the end of the year. We are looking right now, and we're adjusting our request based on the current burn rate.
Great. Thank you. I would make the suggestion that if it's possible to consider possibly quarterly appropriations, knowing we don't have to spend money that we necessarily appropriate, but that way you can meet the demand and needs. I'd be open to that conversation. Thank you so much.
Noted. Yes, ma'am.
Thank you. Ms. LaFrance.
Thank you, Mr. Chair. I put myself in the queue just to comment on legislative priorities, and I can't recall if the committee has taken an opinion on programs offered by UAA, such as the nursing program, and encouraging support of that program. I know there have been conversations regarding certification issues, and I don't have any details, but I would be interested in the committee adding support of that program to its legislative priorities. Thanks.
Ms. LaFrance, would you mind just taking a moment to expand on that a bit? Is there any information you've received that program is in jeopardy in some way?
I received some questions regarding the program that I've not been able to confirm if there is any, I guess, threat to the continuation of the certified program. But given the shortage in healthcare professionals and the stress on the field, especially from COVID, and the need to have that pipeline, especially of local folks, who will serve not just in Anchorage, but in other communities, I think that the program is important and needs some more investigation, but also just general support. Thanks.
Thank you, Ms. LaFrance. I have noted that I'll reach out to that program and gather some additional information and bring it back to this committee.
Thank you, Mr. Chair.
Yep. Thank you. All right, and I see no other members in the queue at this time. Mr. Gerace, any last minute comments before we move to audience participation?
No, sir.
Okay. Thank you. This is we have a few minutes left over for members of the public to speak. You'll just as a reminder, you'll have 3 minutes. If you will just do it first come, first serve, you'll want to give your name, if you can, the area in which you live in Anchorage, and go ahead and start. Is there anybody from the public who'd like to begin?
Hi, I will go.
Go for it.
I'm Celeste Hodge Grouden. I live in Potter Marsh. And I just really want to thank you all for this opportunity to listen in and to obtain this information. I want to comment, though, and just share the Anchorage Health Department COVID-19 Advisory Committee, which was formed to educate, increase, and access vaccination opportunities and testing within the BIPOC communities. And I would love to have the topic of the closing of the Northway Mall access facility for vaccination and switching the site or opening up the site at the Northway Mall be part of our conversation at our next meeting. So just again, thank you for this opportunity. And I did have a question. I don't know if I can ask questions, but I understand from what I heard that there was no charge of the facility at the Northway Mall. And I'm just wondering, is that the same case at the Diamond Center?
I think we can entertain a question. Mr. Drace, do you want to answer that question?
I would be glad to. Just want to make it clear, are we asking, do we charge clients anything to receive services at those 2 locations?
Yes.
No, I'm asking if there is a fee to host the site there.
Diamond Center versus Northway Mall, who's getting paid or not?
I don't have that information. It predates my arrival with the MOA. I could get that for you. Both those sites were set up before I came over, and Visit didn't have optic on that because real estate from the city handled that. So I'd be glad to get that answer. I do apologize. I just don't know. It all predates my arrival at the MOA.
Thank you.
Thank you, Celeste. Is there anyone else from the public who'd like to speak at this time? Okay, hearing none, I believe that we've completed our items today. Thank you very much. I will adjourn this meeting at 10:54 a.m. Everyone have a great day. Bye-bye.